So if we go back to the example I used before of the horse which had two sources of pain, using the 0 to 8 scale, we could say that the baseline lameness was grade 4 out of 8. After desensitization of the foot, the horse improved to grade 2 out of 8. There was no change after the low 4-point block, but lameness was abolished after the subcarpal blocks of the parametacarpal nerves, so we now say it has a grade 0 lameness. And I obviously could also embellish that by some descriptions of how the horse was moving. Horses adapt in many different ways to lameness, depending on the source of pain, the severity of pain, the individual's response to pain, and the type of pathological abnormality causing the lameness. I believe we need a sufficient number of grades to cover a wide range of abnormalities. We often have horses with more than one source of pain causing lameness, and I think it's important to grade the improvement after diagnostic anesthesia under each circumstance in which we see the horse move. There are many clinicians that suggest that a 70% improvement is adequate for a single source of pain. I would tend to differ unless there is severe lameness, and we'll discuss more of this in the sections on diagnostic anesthesia. Let's look at this horse on the right, at the walk. The left forelimb is placed slightly axially, and as the horse walks towards us, we can see that the left shoulder bulges to the left. The horse is almost plaiting in front. There is a shortened cranial phase of the step of the left forelimb. And we can appreciate that this is a slight head nod at the walk. I would grade this lameness as grade 4 out of 8 at the walk. This lameness was only apparent when the horse was ridden and was not observed at the trot, emphasizing the need to grade lameness under each circumstance under which you see it. This lameness is characteristic of shoulder slip. There was no atrophy of the muscles on the outside of the shoulder region, and the assumption is that this must be related to lack of axial stability, perhaps due to damage to nerves in the brachial plexus, innervating nerves on the axial aspect of the scapula. You will have observed that I have seen horses lunged rather than trotted in hand on a circle. I believe that lunging is preferable because it is easier to assess how the horse is holding its body, which may be an adaptation to pain. We can compare the horse's natural balance on the left and right reins. We can look at head and neck position and movement and excursion of the inside hind limb. We can also appreciate the range of motion of the thoracolumbosacral region, or the swing of the back. And I think that these are all important aspects of assessing a potentially lame horse, bearing in mind that with lameness, horses will adapt in many ways the movement of their entire body. So I need to observe whether or not the horse pulls the handler differently on the left and right reins. When it's pulling more or is less willing to go, this generally reflects that the horse is more uncomfortable. If when I ask the horse to lengthen its stride and it breaks to canter, that is an important observation. The horse doesn't want to lengthen its step length. And I also think that although we cannot see overt lameness in canter, both with forelimb lameness and with hindlimb lameness, the quality of the canter may change, and it is important to appreciate this as well as a detection of lameness. So I want to ask the question, especially with forelimb lameness, is the step length and balance the same or different on soft, firm and hard surfaces? Most but not all foot-related lamenesses are worse in circles compared with straight lines.